Hello everyone and welcome to PEHP's Take Charge class. My name is Jill Bryan and I am a registered dietitian and a certified diabetes educator with PEHP. I've worked with PEHP for about 10 years now and I think this is a wonderful class to take, so I'm excited to have so many of you joining me for the next 6 weeks. We have just over 500 people registered for the class. So I just like to have the first class live just to go over some information, and then I will offer the additional classes live as long as there's enough people that are interested in participating live. But if you can't join live, that's totally fine. I do record each of the classes, and then I will send out a link to that recording, usually on Tuesday morning, and then you can listen to the class whatever time during that week that is best for you. So thank you again for joining me. Today the class, I'll try and keep it ending around about 12:45. So I just wanted to go through a little bit of the background about this class and what to expect before I get started today. So this class is based on actually a year-long program that was developed by the Center for Disease Control. It's a program called the National Diabetes Prevention Program. So it's a scientifically based class that they did for a whole year. And then they actually teach this course at different centers throughout the United States. So I went through and kind of condensed some of the information from the first 16 weeks of the class. Usually people meet each week. So I went through those first 16 weeks and kind of pulled some information to create this class and condense it a little bit. If you find at the end of the 6 weeks you would like more information, or even if you're interested in joining a class, please just let me know and I can help you find a class close to your area. So based on the research that was done on this class, it's actually been, they said, scientifically proven through the study that was done that by following the concepts and the information taught in this class, that it was proven that people were either able to delay or prevent a diagnosis of type 2 diabetes and other serious health complications. So, and most of the changes that are presented in this class are just small changes that we recommend you make over the next 6 months and then continue on throughout the rest of the year. So it's nothing drastic or dramatic, but they did find that these small changes were able to make a dramatic difference, and I'll go through a little bit of that information in the class. So as I mentioned, it is 6 weeks, so every Monday I will do a live class at noon. And then usually on Wednesday or Thursday, I will send out additional support material to help kind of reinforce some activities to have you do throughout the week based on what we're talking about that week. So, and I just want everyone to know if you have specific questions or you need more information, I'm happy to answer any questions you have. So either please just send me an email or I'm happy to schedule a phone consultation as well. And we can do that as part of the class. So each week as part of this, the National Diabetes Prevention Program, they're called participant guides. And it just is a resource for you to have to help set goals based on what we're talking about. So in the email I sent out this morning, I did attach the introduction to the program participant guide, and then later in the week I will send out the one for week 1 on exercise. So the one that you got today does go through and it kind of walks you through setting up one of the goals for the class. So if you have that, when we get to that, you can open it up and look at it, or you can look at it later on this week as well, whatever works best for you. There is a chat box open, so I'm happy to answer questions that come up. If I ask questions, I encourage a little bit of participation, but just do whatever you feel comfortable with. So let's go ahead and get started. So this is kind of the goal of the class, really is I'm hoping that you'll use the information that I send out, the resources that are provided to help you make whatever changes that are necessary so that you can decrease your risk for developing type 2 diabetes. Currently in the US, at least from the statistics from the Center for Disease Control, they said more than 1 in 3 American adults currently has prediabetes. I think the scariest part of that, as I said, 9 out of 10 people are living with prediabetes and don't realize that they actually have it. So we do know based on research that if you've been diagnosed with prediabetes, that you're more likely to go on to develop type 2 diabetes, possibly heart disease, and then also at an increased risk for having a stroke. So I think it's a great time, especially if you've recently had any blood work done or in the past you've been diagnosed with prediabetes. This is the best time to make a few changes. We do know based on this research that you can decrease your risk or even prevent or considerably delay a diagnosis of type 2 diabetes. So today's objective with the class, I really just want to go through and identify some of the risk factors with prediabetes, and then help you set 2 very clear specific goals based on this study that was done. And I'll go through and kind of walk you through how to kind of identify this. You don't need to jump right in and start today unless you're ready to do this, but the 2 goals were one was to decrease your current body weight by 5 to 7% over the next 6 months. And in the participant guide that you received, that will kind of walk you through how to do that, how to calculate what that number is, and then set a reasonable goal. I really like this goal and I love the research that supports it, because I think a lot of times for anyone that feels like they may be carrying any excess weight, sometimes it can be very overwhelming if you look at the BMI charts and think, okay, I need to be here. Maybe you need to lose 50 pounds or 100 pounds or more to get into that range. But we do know based on research that even just losing some of that weight, that top weight, it can really, really help with prediabetes, especially because it helps lower the insulin resistance that a lot of people are experiencing. So I think this is great. I think it makes that goal a lot less overwhelming and more achievable. And then the other goal based on the research is to obtain at least 150 minutes a week of physical activity. And that will kind of be the second topic that I'm going to be discussing today. And then next week, we'll talk about nutrition and how that can fit into supporting these 2 goals. So I wanted to start by just talking about what exactly is prediabetes. So a diagnosis of diabetes, whether it's type 1 or type 2, usually occurs by testing blood sugar levels on a couple of different occasions. So one of the tests that is often done is called a hemoglobin A1C test. And this test, it helps look at where your blood sugar has been on average over the last 2 to 3 months. So I think this is a wonderful test. It's not just a one-time test you're having done fasting, but it actually looks at an average over those 2 to 3 months. So if your blood sugar is higher than 6.5% on the A1C test, that can be a diagnosis of type 2 diabetes. Or if you were going in and you'd been fasting for at least 8 hours, and you had your blood sugar tested and it was above 126 milligrams per deciliter, that would also be a diagnosis. And most doctors will do the same test at least on a couple of different days, or they'll do 2 different tests on a couple of different days to confirm that diagnosis. So prediabetes is when your blood sugar level is elevated, but it's not up to quite that high. So we're looking at A1C for prediabetes, it's 5.7 up to 6.4%. So if you've had your blood work done recently and you have had an A1C test, I would encourage you to pull that up, look to see where your number is, or if your fasting blood sugar level is between 100 up to 125. They can do something called an oral glucose tolerance test as well. For the women, if you've ever been pregnant and you were screened for gestational diabetes, it's the same type of test. They give you a specific amount of sugar, kind of in a drink. It's kind of a really concentrated sun-kissed drink. You drink that, and then they'll test your blood sugar levels a couple of hours later to see where that is. So these 2, A1C and fasting, are much easier than doing a glucose tolerance test. But one issue with prediabetes, I think that's very different from type 2 or type 1, is there's not a lot of symptoms that you're probably experiencing. The only reason you probably would ever know you had prediabetes is if you had blood sugar work done and it showed up and your doctor told you. So you could have prediabetes for a long time and not ever know it until more serious health problems start to arise. So like I mentioned, most people don't know that they even have it. So generally, like I said, there's not any signs or symptoms. For some people, if you have a severe form of insulin resistance, which means that your body's still producing insulin, but the cells in your muscles, in your liver, in your fat cells that normally take insulin in and use it so that you can transport that glucose into those cells to be used for energy. For some reason, your body becomes a little bit resistant to using that insulin properly. And so for some people, they get these dark patches of skin on their body. The most common place we see it is on the back of the neck. And you can see from this picture here, it's a very thick, dark and kind of velvety patch of skin that people will have with that. So that's one place. Other places tend to see it are just on areas where the skin tends to be a little thicker on the body. So your neck, your armpits, your knees and elbows, and then your knuckles can all have these this darkened area as well. So that's one symptom that you may see. Something that puts you at risk for this would be being overweight. I mentioned insulin resistance. What happens is you just get an enhanced production of epidermal cells, and so it just becomes thick and velvety. But it's usually people that have a little bit darker skin pigmentation that are going to see this more. So a lot of people won't ever see this sign or symptom either. If you do have prediabetes, you're more likely to go on to develop type 2 diabetes if you have any of these risk factors that are listed on this slide. So if you're overweight, over the age of 45, if you have a parent or a sibling with type 2 diabetes, you're currently not very active, you had gestational diabetes, or you come from any of these different groups listed on here, all of these are going to put you at an increased risk. So there is a test you can take if you haven't taken this before to see what your risk currently is, but if you already know that you do have prediabetes and don't necessarily need to take this, but it'll just kind of walk you through answering some of these different questions that are on this slide here. I've heard this, and I point this out because I've heard this from my parents as well, is that they're like, oh, I went to the doctor. My doctor told me I had prediabetes, but said it wasn't anything to worry about right now. So I don't know if a lot of doctors just say, oh, your blood sugar level is a little bit elevated. Let's not worry about it till it's more elevated and now you actually have type 2 diabetes. So to me, that's very concerning, just because this is the time that you can do something to reduce your risk. A lot of times once people have already been diagnosed with type 2 diabetes, it's very hard to reverse that diagnosis. So I think this is the perfect time to make some changes. So if you want to learn a little bit more about type 2 diabetes, or more information just about diabetes in general, there is 2 links here when you get this presentation. I will send out a copy of these slides. I would just encourage you to watch these if you are interested in that. So I don't know if anyone else has heard something like that from their doctor about, oh, don't worry about it right now, but I would definitely recommend taking it serious. So one of the concerns and the real reasons we want to prevent people from progressing to a diagnosis of type 2 diabetes is because as your blood sugar levels get higher and higher, so as your averages run higher, the biggest concern is having that excess glucose circulating through your body all the time is the damage that it can cause, mostly to the different vessels. So small vessels in your body are very sensitive to high levels of glucose. So you can see on the screen here, and probably a lot of you have heard of these different complications that come from type 2 diabetes. So most people, these are very scary, they're very serious, they can lead to a lot of health complications that can make a lot of drastic changes to your overall health and way you live your life. So you want to prevent these and not even have to worry about dealing with these, because if you can reverse the diagnosis or even stay in the prediabetes stage, your risk of having these complications is going to be much, much lower. So what can you do now? So you're taking this class, which I think is awesome, a first step to getting the information that you need. So my recommendation today, as we start this class, is for this week, I would like you to set the goal of figuring out if you do need to lose weight. Again, what would be 5 to 7% of your current weight that you would need to lose? Again, it doesn't need to be lost in the first month. I would say try and lose that weight over the next 6 months. As a dietitian, and I've worked with a lot of people, and I know people like to lose weight really quickly. People want to see results when they're getting on the scale each week, but usually if you're losing more than 1 to 2 pounds a week, I find people are doing something pretty drastic that they're not going to be able to sustain for a long period of time. Based on kind of current research in nutrition, there's really not one type of specific diet or eating pattern that works best for everyone. So I usually tell people start where you are right now with your diet and make 1 or 2 small changes to that. You don't need to completely change everything that you're eating, but maybe just pick a couple of your recipes, find out ways to make them a little bit healthier, or just eat what you're eating right now and make the portion sizes smaller. I think is a great way to start and reduce calories without having to feel too overwhelmed with making all these changes all at once. Next week, I'll focus more on nutrition and give lots of ideas and recommendations on how to make things a little bit healthier. But start with that goal of losing weight. So use the participant guide, kind of go through that. And then the other one would be to set the goal of the 150 minutes a week of exercise. And I'll go into more of that in just a minute here. But if you can, I would say get support as well. It's going to be easier to eat better and to be active consistently if you have the support of family and friends. For some reason, I always find that if I have support, it's better. Some people are very insistent, like if I go out to eat with people and they were having dessert, for some reason, people like to push that on people. But I think if people know that what you're doing and you're trying to make changes, they can be supportive of that instead of always wondering why you're not eating certain types of things. Or so I would say if you can attend the class, that would be great each week, so you can ask questions and get the information that you need. If not, please just try and listen to the webinars each week and then complete the learning activities that I discuss in the classes and that are in the participant guides as well. As part of this class, they really encouraged the year-long program that people do. They really encourage that people track their food and they track their physical activity, I think just as a way to monitor themselves. I think tracking activity is great. I think tracking food for some people is very, very stressful. So even if you can only track your food for a week or two, I think it really helps just create a baseline of where you are. If you find that that's helpful, you can keep doing it. But if it's very stressful, then I don't necessarily think it's critical to do that. But I do think just for a week or two is really helpful. Next week, I'll go through some different food apps that you can put on your phone that are free that will make it much easier to track the food, and I think make it so it's not so stressful, but give you some really, really good information on where you are with your diet. So losing weight, like I said, goal 5 to 7% really had significant benefits. If you get to that point and you feel like you want to lose more weight, that's great, but they did find the 5 to 7% really helped to bring down the insulin resistance that people were experiencing, and that's what really brought the risk down for a lot of people by taking that top weight off. So if you look in your participant guide, if you guys have access to your email that I sent out, if you look at page 3, it'll kind of start walking you through some of the goals. And then on page 5 of the participant guide, it just says your 6-month goals, and it says, okay, what is your current weight today? If you feel comfortable weighing yourself, I would say maybe weigh yourself tomorrow morning so you have a starting point for this class. You can write that on here and then figure out in the next 6 months you want to lose either 5, 6, or 7%. Pick an amount that you feel is realistic for you at this time. And then again, my recommendation would be 1 to 2 pounds a week. For the next 6 weeks, I would like to recommend, if you're okay with this, to try and just weigh yourself once a week. So pick a time, I'd say in the morning, where you're going to be consistent. I know people like to maybe weigh themselves every day. Sometimes I think that's stressful because you might see your weight go up and down each day. That can be very discouraging. Our body weight fluctuates quite a bit based on hydration. So if you can pick a time each morning, the same day each week, track your weight and see how you're doing, but try and kind of resist the urge to weigh yourself several times a week. I think once a week is totally fine. If you keep looking at the participant guide, kind of go through how to pick the numbers, but if you go down to the last 2 pages, it's pages 7 and 8 of that guide. You can find your weight on here. It starts at 130 pounds and goes up to 309 pounds, and then it will actually, I guess it goes higher than that in these different columns. 417 is the highest, but it will show you 5, 6, and 7% exactly what the pounds are, so you don't have to calculate it on your own if you don't want to. So I think that will help so that you have a good solid goal of what you're going to be working towards for the next several months. So based on the diabetes prevention program, on the study that they had done to develop the program, they found that losing 5 to 7% of weight, again, I mentioned prevent or delay type 2 diabetes. It also helped ease a lot of sleep problems. We know that people that have sleep apnea are at an increased risk for developing type 2 diabetes as well. If you have arthritis or depression, losing weight can help with both of those, lower blood pressure, lower cholesterol, and then just help you feel more healthy overall. So some great health benefits from just losing that top a few percentages. So again, this will go through, I just recommend kind of referring to the participant guide to determine your weight loss like I just mentioned. So a couple things I wanted to point out also with the study that was done. I want to make sure I find the exact right percentage here. Just looking at my notes really fast. So when they did this study, they broke the people into 3 different groups. So one group was a lifestyle change group. This is where they recommended that they lose the 5 to 7%. They do 150 minutes of exercise each week. And they found that for the lifestyle change, they recommended for exercise, it was walking 5 days a week for 30 minutes. So nothing totally crazy that people had to do. They also recommended they decrease their overall fat intake a little bit and then to reduce their calories. They found most people lost about 15 pounds in 1 year at the end of this program. And the second group just took metformin, which is a medication that is usually prescribed when someone's blood sugar level starts to go up. And then the last group was just a group where they were given some educational information and not really any guidance on exactly what to do. So they found that by far the lifestyle change group had the best outcomes at the end of this program. So they found that they were able to decrease their risk for developing type 2 diabetes by 58% over a 3-year period. So, I mean, a dramatic decrease. If for those people that were over the age of 60 during this study, they actually found their risk had decreased by 71%. So a huge difference by reaching these 2 goals. The one group, the metformin group, they were able to decrease their risk by 31%, but they were on a medication to kind of keep that under control. So great benefits by losing a little bit of weight and then figuring out ways to be active. So, and I think if you're thinking, okay, I need to lose 20 pounds, and you divide that over a 6-month period, I mean, you can lose it a little bit faster, but I really think that's realistic. For people, I do know losing weight is very difficult and keeping weight off can be even more difficult, but I think if you'll set yourself up to make small, realistic changes that you can continue doing for a lifetime, it's going to be much more realistic to lose the weight and keep it off instead of doing something completely drastic. So to talk about exercise, it's kind of the topic of week 1 of this class. I want you to start by thinking, if you have a piece of paper there, maybe writing down 4 or 5 types of activities that you enjoy doing, that you don't feel like it's going to be a chore. I know when I talk to people about exercise, if it's something you don't like, instantly people are like, "Ugh, I just hate it. That's going to be a barrier because I don't enjoy exercise." And I think a lot of times that happens probably because you're doing an activity that you don't like to do. If it's something that's enjoyable, I think it makes it a little bit easier to do and something that you can even look forward to doing. So maybe just take a couple of minutes as I'm discussing these first few slides here, and just write down some things that you know you would like to do. Being active has so many health benefits besides losing weight. If you've ever been on a treadmill or some of those machines, sometimes it tracks calories, which I don't always love because I feel like there's so many good benefits that come from being active besides worrying about how many calories you're burning by walking on the treadmill for a certain amount of time. I think it's much easier to lose weight by cutting back what you're eating a little bit than trying to burn a lot of calories through exercise because it takes a lot of time. I do think it can contribute to that overall calorie deficit. And keeping weight off, it's very, very important to be active. But if you look on here, there's so many great benefits to being active. So focus on some of these. And then again, let's focus on things that you like to do as well. So you may be wondering why physical activity was such a big part or one of the main goals of this program. And so there's been a lot of research done on this area about why do we need to stay active or what can it do to help. And the biggest reason is because when you're active, your muscle cells are very, very actively using glucose. And so as you're active and you're burning energy and you need to continue to make energy to get your muscles to move, your cells become much, much more sensitive to the insulin that your body's producing. So your insulin resistant level drops. You're actually able to move glucose from your bloodstream into your muscle cells without even using insulin. So it's a natural way to bring blood sugar levels down, reduce insulin needs while controlling your blood sugar levels. So for a lot of times with people that do have type 2 diabetes, I'll tell them one of the easiest and best ways to help bring your blood sugar levels down without relying on a lot of medication is to go for a walk. Go for a 10-minute walk after dinner. See what effect that has on bringing blood sugar levels down. I think most people are very surprised how much doing a little bit of activity can really help. So this is one of the biggest things, is really the benefit it has on insulin resistance and just making your cells more sensitive to insulin. Other thing is it really does go hand in hand. Diet for sure is the biggest portion, but physical activity does take calories. And so if you can reduce calories a little bit, make a few changes in your diet and be active, it's a great way to combine both of those to help with weight loss. So a little activity I mentioned, so things that you truly enjoy. So maybe just a little bit of interaction here if you have your chat box open. I would say, I just want to, maybe you can either type in maybe some of your favorite activities that you're thinking about doing, or I also want people maybe to share what are some of the barriers that you think you might experience, or things that have prevented you from being consistently physically active in the past. Because if the goal is to have 150 minutes a week, I realize there's going to be barriers to that. If you're not currently doing it, there's probably a reason that you're not doing it. So if you want to share something that you truly enjoy that you're going to look forward to doing, or if you'll share maybe something that you feel like might be a barrier to this. So, and perfect. And I want it to be something, I think there's something that most people really do just love and enjoy doing. And it really, exercise can be anything that gets your body moving. I think a lot of times people think instantly, oh, I'm going to have to start running or doing something like that, which a lot of people don't enjoy. So it doesn't have to be that for sure. So perfect. So as you guys are typing these in, I'll just share some of these. So, and I love there's a huge variety of activities. So people said yoga, water aerobics, pickleball. I know pickleball is huge right now and it's a fun way to be active. Walking, riding your bike, hiking. I think in Utah in the summer is awesome. We have so many different activities we can do. Um, and then some of the barriers, I think time is a huge one for a lot of people. Maybe motivation. So we'll go through some of these, maybe ways to overcome some of these. Weightlifting is awesome. Based on research, the more muscle mass you have, the higher metabolism is going to be. And the more muscle you have as you're active, you're going to be able to move more of that glucose in. So weightlifting is awesome. I know some women tend to kind of worry about that, but I would say that's for sure something I would recommend for everyone because it can help build lean muscle mass. Um, that can help better regulate blood sugar levels, and that can also just help keep your metabolism up. So paddle boarding, some people say they don't like to sweat, which I understand that. Kids, time demands for sure. I think with school starting back up, that's going to make it a little bit more stressful also. Maybe there's some health issues that you're dealing with. If you have pain, I know some people that's hard. And I will send out some really good resources for all different abilities that can help with movement that'll make it a little bit easier as well. Maybe the cost of doing something, just motivation. So, okay, perfect. There's lots of different things, and I think we all have a lot of different barriers that we have to deal with in our life. So my goal in here this week too is to really have you sit down as you're thinking about what exercises you love to do, that you want to do, and then be realistic in when you're going to be able to do that. Sometimes I think people get very, very busy. And so I think exercise gets kind of pushed to the side sometime. But as you're calendaring and you're looking at your week and your day, I want you to kind of maybe change your mindset a little bit and think that, okay, this is very important. I'm going to put this on my calendar. I'm not going to let anything else kind of override this, that this is very important. I'm an important time that I want to change my health. And so if something comes up and someone asks you to do something and you already have your exercise scheduled, say, don't cancel that to do something else. Make that just as important. And if you haven't been doing exercise for a while, if you can get in the routine of slowly building up to 150 minutes a week, I think you'll realize and see how much better you feel when you are exercising consistently. And that can be a big motivation to keep exercising as well. So if we think about 150 minutes a week, usually it's best if you can divide it out throughout the week a little bit. So that's why they say 30 minutes, 5 days a week. But I think if you're short on time, it's even easier to maybe divide that 30 minutes up into maybe 10 minutes 3 times during the day. I think that's much more realistic than if you say, okay, I'm already short on time, I'm very busy, maybe you're really tired at the end of the night, and that's not realistic. Say, set yourself up and set up your pattern to be something that's going to be really, really doable for you, something that's going to be realistic. So if you're someone that likes to get up early in the morning, say get up, do your exercise in the morning before your day starts, because then it's done and you're starting your day off great. You're getting your exercise time in. If that's not realistic, then maybe say, I'm going to get up and do 10 minutes in the morning. Maybe I can do 10 minutes at lunch and then I can do 10 minutes in the evening. I think we can all find 10 minutes a little bit easier than maybe finding 30 minutes at a time. So That would be my other recommendation for this week. Really sit down and do what's going to work for you. If you're someone that needs motivation, or you feel like you're going to be more consistent if you're exercising with someone, or if you're going to a class, maybe reach out to a friend or a family member and see if they're interested in starting to do an exercise program with you, or if they're willing to walk with you for a couple of days or whatever your activity is going to be. And I think it really depends on what you like to do. Some people love to go to the gym and do classes that way. It's easier. Some people don't like that. That's a barrier to going to the gym for a lot of different reasons, maybe the cost or the time. So sit down one day and just brainstorm, write down all the barriers you might have, look at your schedule, write down the activities you like, and then try and add a little variety to what you're doing, but really make your plan very simple and very realistic for you. I think that's really, really going to help. If you have kids, maybe find ways to have your kids be active with you. I know when my kids were doing a lot of different sports and I was in the car a lot of time, I'd be sitting there and decided I'm just going to get up and I'm going to walk wherever I am. If they're at a school and I can walk the track there instead of just sitting in my car waiting for them to get done with practice, that was an easy way for me to get a little bit of activity in. If you can walk your kids to school, or if you can just find things that they enjoy doing as well that maybe you can do together. If you're sitting and you find that you're someone that's sitting and watching TV a lot in the evening because you're tired and it's a good way to relax, maybe just make a goal that during the commercial breaks or after you've been watching a certain amount of time that you're going to get up, and even if you're walking around your house or your neighborhood or walking stairs in your home, there's lots of ways to break up that sitting time that will help you add in your physical activity time. So lots and lots of ideas on how to do that. So someone asked about heart rate. So with this program, when we're talking about exercise, we want to make sure that we are getting our heart rate elevated a little bit. And there's a couple of ways to do that, because one of the benefits of cardiovascular exercise is kind of strengthening your heart, your cardiovascular system, but we want to make sure we're working out at the right level. So one of the ways to gauge this, and I'll go through a couple of examples here. One is called the talk test. So when you're walking with someone, you want to be able to feel like you're able to still have a conversation, but that you're working out hard enough that maybe you wouldn't be able to sing a song. It's an easy way to kind of gauge your breathing. So simple way to do that. So just gauge, if you feel like you're just walking at your normal pace that you do every day, you're probably not exercising at a high enough intensity. So if you're walking, it would be there just maybe just picking up your walking pace a little bit, or maybe picking an area in your neighborhood or wherever you like to walk that maybe has a hill that would give you a little bit, increase your intensity a little bit, even if you kept your pace the same. Let me see if there is. So the heart rate one is not on here, so I will send out some information. I don't think it's in your participant guide either. But with the heart rate test, if you want to, if you feel like the talk test, you might not be able to gauge that very well, then I will send out what the numbers are, and it would be an easy way you could do it. Let's say you're into your exercise 5 or 10 minutes. You're just stopping, you're checking to see your heart rate. You can do it for 20 seconds. You simply multiply it by 3, and then there will be a range based on your age that you want to make sure you're in. So that's an easier, kind of a more, say, data-driven way to see if you're in the right range. And I'll send out some of that information this week so you can look on how to do that appropriately. And that's mostly just looking to see what range you're in. You also don't want to be working out too hard, especially if you haven't worked out in a while and you don't feel like you're in really great shape. So these are some, when you get the participant guide on physical activity, I will send this out either tomorrow or Thursday. But the thing that it goes through I really like is it identifies different challenges or different barriers people have. It goes through lots of ways to overcome those barriers, and then it gives you an area here where you can write down some of your ideas as well. I do want to caution you that if you haven't been exercising, or you do have any type of a chronic health condition currently, please just take time to talk to your doctor about it. I don't want anyone to have any adverse health problems. Most of the time, if you're going to be walking or doing something that's not really, really high intensity, there's not a lot of problems. But just if you feel like this is something you need to talk to your doctor about, please take care of that before you start doing something. But so a couple of other things I want to point out with exercise is be flexible with your schedule. I think sometimes we miss a day and then we kind of beat ourselves up and we make ourselves feel really bad about it. But there's going to be days where you're not going to be able to be perfect with what you're eating or your exercise, and that's fine. We don't need to be perfect. Our goal is long term to make some of these good, realistic, practical changes as we worked on improving our health. So be flexible. You might need to change some things. Usually with exercise, they recommend variety just to prevent boredom, but it also helps prevent injury if we're not doing the same thing every day. And then it also helps with just overall fitness, because if we're doing different activities, we're using different muscle groups, and that is just helpful. And then it also helps prevent boredom. But some people are totally happy doing the same thing all the time. I would say if you're going to do that, then add variety to maybe where you're walking or where you're riding your bike or different things you're doing. That'll just help with overall fitness. So try and avoid the all or nothing way of thinking. So just an example of this. So I'm someone, I actually like to run. And so for me, I felt like, okay, I need to get up and I need to run for 30 minutes, 3 or 4 days a week. And if I didn't get up on time and I knew I couldn't run for 30 minutes, I was in this mindset of, well, I've kind of blown it for the day. Now I can't do anything. And I've shifted that quite a bit, where if I get off my schedule at all and I get up and I think, okay, if I can only go for 10 or 15 minutes a day, that's still very beneficial versus not doing anything at all. So if you tend to have that way of thinking, I'd say just try and take a step back again, look at the overall health benefits and realize, okay, if today I can only do 5 minutes of exercise, that is still going to contribute to my overall minutes for the week. It's still going to help you be in the routine of exercise. So do what you can instead of not doing anything at all. And then again, if you look at the participant guide that comes out, just see if you can relate, if you have some of the similar challenges that other people experience, and then maybe look at some of the ideas if you need some ideas on how to get past some of those barriers. So with physical activity, it is something that I would encourage you to track, just so you can see. I think in my experience of working with people tend to underestimate how much they eat, and they tend to overestimate how much they're exercising. So I think that's one good reason to track items. So whatever's going to work for you, if you have an Apple Watch or you have your phone with you all the time, those are simple ways to track your time or your steps, but find something that's easier for you. I don't want the tracking to become a barrier and something you kind of dread doing. So make this very, very easy. But when you're setting up, when you get this plan, this really goes through and kind of helps you set up specific goals, kind of the SMART goals on, okay, where am I going to do this? When, how long, challenges, just so that you can kind of get over some of the barriers. So take time, set this up. I would recommend scheduling it, but if you feel like it's going to be pretty easy, then maybe you don't need to be so specific, but find a way that is going to be easy for you. So again, just your time, record how many minutes you're doing it. I think this is all pretty self-explanatory. Usually the goal has been to try, if you want to do steps, it's been to try and get about 10,000 steps a day. I mean, that usually equates to about 5 miles walking. You don't necessarily need to do that, because if you're not doing an activity, you can track steps, but that also doesn't necessarily mean that your steps are at a high heart rate either, high enough. But find something that's going to work for you. If you haven't been exercising a lot, then I would say try and just start with 5 minutes a day. Just get in the habit of being active, and then as you feel good about that and are comfortable with that, just keep adding a little bit of additional time each day until you can find a good schedule and you are realizing, okay, I'm getting up to the 150 minutes a week. of exercise. In the fitness log, there's a way to do this if you feel like you really want to write it down. I don't really foresee a lot of people doing it this way. It's either do it on a tracker or do it on your phone, but just come up with something that's very, very simple for you to track this. So if you feel like you want to be accountable to someone, if you feel like you want to send your time into me each month or each week and say, hey, this is where I am, this is where my calories are, if that would be helpful, I'm happy to look at that and give feedback as well. If you want to be accountable to somebody, I'm happy to work with you through this class to do that. So that's kind of the end of what I wanted to cover today. Does anyone have any specific questions about exercise or about the class as we kind of wrap this up today that you're wondering? If you don't feel comfortable asking it on here, then please just send me an email. My email's up here on the screen, and I'm happy to answer any questions. So if we don't have any questions, then that is totally fine also. I'm going to stop the recording here. But again,